record now. Hello, and welcome to our age-friendly conference, Reimagining Aging in the New Normal. I bring greetings from our county executive, from Commissioner May Carpenter, and from Colette Phipps, who was not able to be here because an emergency arose. My name is Jennifer Crawford, and I am a program specialist in the Livable Communities Unit of the Westchester County Department of Senior Programs and Services. I'm thrilled to present today's age-friendly collaborative conference virtually. As many of you know, and like so many 2020 calendar plans, we had to cancel our in-person event this year, scheduled in April 2020 due to the COVID-19 pandemic. As someone who has lost a family member to the coronavirus, I thoroughly understand the importance of safety at this time. With that, I am so grateful that we have persevered and found a way to come together online. This is what our age-friendly collaboratives and all of our collaboratives do. They bring people together. And we are so fortunate and grateful to have Paula with us today, a New York Times columnist. The mission of the Age-Friendly Community Sustainability Collaborative is to engage organizations and individuals in shaping and sustaining communities that work for everyone. We accomplish this by sharing resources among peer networks and leveraging the talents, skills, and expertise of older adults. With that, I'm going to hand it over to Louise Shallop, With that, I'm going to hand it over to Louise Shallop, our age-friendly co-chair, to introduce Paula. Louise?
Yep. Thank you so much, Jen. And it's so great to see so many familiar faces and friends and people I haven't seen for quite some time. And I miss you all. And on behalf of my co-chair, Deb, and I am happy to welcome you here. So Paula, backed by popular demand, writes the new old age column for the New York Times. A veteran journalist, she was earlier a reporter for the Washington Post and has contributed to many national magazines and newspapers. Since 1999, she has taught at the Columbia University Graduate School of Journalism. She spends one day a week caring for her 4-year-old granddaughter. And her audiobook, The Bubby Diaries, will be released early next year by Audible. And with that, I hand the program over to Paula.
Hi, all. I see some familiar faces too, and I'm remembering when the last time I was a speaker at this conference, our biggest problem was a snowstorm. Remember that? And we had to move the venue at the last minute, and our biggest problem was, can we get me from New Jersey to Westchester in a snowstorm? And now I think, well, that was easy. that was a simple problem. Can we go back and have problems like that? So now I have the pleasure, but the challenge also of talking to you about aging in an era that is very different and sometimes feels just unrecognizable. So what does it mean to grow older now? And I'm including myself, I'm 71, in a pandemic, unless you're old enough to remember 1918, and mazel tov to you if you are. None of us have been through a period like this before. It's not unreasonable for us to be fearful about it. We know that people over 60, we are not more likely to contract coronavirus, but we are more likely to get very sick if we do. And we are more likely to die, especially in long-term care like nursing homes. So that's just our current reality. But we are learning a lot more as the months go by about what it takes to be healthy and safe and active in a time like this. What makes things better, what makes things worse. And I've been reporting on these issues in the new old age column as the months go by. In fact, I sometimes feel like I've hardly been reporting on anything else. So I'd like to share some of what I've learned about aging in the new normal. So first, I think to acknowledge the risks. The risks are not only from COVID-19 itself, right? Social isolation in itself is dangerous. Jen, can you put up that first link? We had experts sounding the alarm about this long before the pandemic, because about a quarter of seniors are considered isolated, meaning that they lack social connections. And about 40% say that they feel, I'm sorry, this is the new old age column, so you can see what it looks like. It appears every other week in the Science Time section in print and online. So, but Jen, can you go to the next one? Yeah. So isolation. This lady in an assisted living in Virginia is 98. This was the first time she was seeing her daughter and son-in-law in months. And you see what they had to do. They had to sit on the opposite sides of the doorway. They had to wear masks. It was hard to hear each other. But at least they could see each other. And the daughter, Ms. Baum, was telling me that she was looking at her mother to see, well, she got her hair done, so that's good. She doesn't seem to be losing weight, because she couldn't go into her room and help care for her and monitor her health the way she always did. She was there daily before the pandemic, and now she was reduced to this kind of interaction. So long before we ever heard the word coronavirus, experts knew that this was a problem, because isolation not only affects our mental health, as you might expect. We can go back to the speaker view, Jen. It not only affects our mental health, anxiety and depression both go up with isolation, but it actually affects our physical health too. So the National Academy of Sciences, Engineering and Medicine brought out a big report in February, and they had been working on it for 2 years, that collected all of this data and pointed out people who are isolated have higher rates of heart disease and stroke. They are more susceptible to dementia. They have an increase in mortality that is actually equal to smoking or obesity. And then, so isolation is dangerous. And then last spring, we were told to do that very thing that is dangerous, which is to isolate ourselves. So we obviously need to find strategies that help us feel connected. And we particularly, I think, need to be aware of the dangers to our seniors who are in long-term care, especially nursing homes. But assisted living has been affected by this too. Some of these residents have not had regular contact with their family for months. They are isolated in their rooms. In many places, communal meals and activities have been suspended. So this is just a prescription for decline for these residents. It's not healthy. It's not sustainable. And so leading geriatricians are sounding the alarm about this now too, and saying that there should be a way to designate specific family members, maybe one per resident, to test those people, to train them in the use of personal protective equipment, and to give them access so that they can be regular visitors with their loved ones. Because these family members are not just visitors. They're not just paying social calls. You know this, they're part of the care team. They are helping with feeding and dressing and grooming, and they are monitoring their family members' health. They are the ones that will tell the staff if something is wrong. So we need to find a way to let them back in. And in Holland, there has been research showing that when you do it in a smart way, you can bring family members back into a care home without making your COVID rate go up. So if we're smart about it, we can do that. And I'm hoping that with guidance from CMS, more nursing homes will start doing that. The other loss that we face, aside from our in-person connections, is we may temporarily feel that we have lost our sense of purpose. Purpose being that reason we have to get out of bed each day, the things that give our lives structure and meaning. Maybe the volunteer activities that brought us satisfaction have been shut down for now. Maybe we had jobs that we wanted to hold on to for a while, and we've been furloughed, we've been laid off. Maybe we've been caring for our grandchildren and helping to raise the next generation. And now, in order to protect us, the seniors, our children in the middle, are saying, no, we're going to stay away from you. And they have only our best interests at heart, they think, but I'm not sure that that is our best interest, because purpose is another one of those things that social scientists can measure. They use scores on questionnaires. And we have learned that having purpose is vital to our well-being at any age, but especially at older ages. Older people who have higher senses of purpose measured by these scores, they live longer, they have less cognitive decline, they have better physical function, they even sleep better. If the pandemic has taken away our sense of purpose, that's dangerous too. But the pandemic has also brought some changes that could make our lives better, even if some of them are having a slightly rocky start. So if we can see the next link, Jen, one of the things that's changing, and you've probably seen it yourself, is the next one. Yes, telemedicine, sometimes also called telehealth. Like, if I can talk to you this way, why can't you talk to your doctor this way? Well, now you can. For years, telemedicine was very rarely used, mostly in rural areas. And the reason was that Medicare had very stiff restrictions on when you can use it and where you could use it. And even if you could use it, the doctors and the clinics and the hospitals got paid less to do telemedicine than they did for in-person visits. So clearly, nobody would do it. Then came COVID and all that changed, and it changed so fast that one health executive said to me in, I guess, April or May, things have changed more in the past 20 days than in the past 20 years. Medicare lifted those restrictions. It actually began encouraging us to have visits by phone, by video chat programs like FaceTime, by Zoom, by other platforms that are proprietary to healthcare systems. And importantly, it began paying the same fees for telemedicine as it did for in-person visits. So now those were temporary changes, and we have to see if Medicare is going to make them permanent or not. So not all older adults are comfortable with this technology, but it will improve. And to have this as an option, at least, seems to me a smart move. If you're a caregiver or you work with caregivers, you know that taking older adults, parents, spouses, relatives, friends, clients, taking them to their many medical appointments takes a lot of time. Sometimes it is physically difficult, especially in the winter. It's exhausting. So sometimes, yes, the patient and the doctor need to be in the same room. She needs to put her hands on you. But lots of times what we're doing with our doctors is talking about medications, talking about lab results, talking about what to do next, talking about decisions we have to make. And to talk, we have many more ways to do that now. So I would argue that this, on the whole, is a plus, telemedicine. Can we go to the next slide, Jen? I'm also hearing a lot about robotics. And I admit to having really mixed feelings about this one. So maybe you've seen some of these robotic animals. This cat in this lady's lap is not a real cat. This is a robot cat. They're furry. There's robot dogs too. They're furry, they purr, they wag their tails, they nap and wake up. They have heartbeats. They respond to their owners. And during the pandemic, several states, including New York State, ordered 6,000 of these robots to distribute to seniors who were lonely or isolated. And now some Medicare Advantage plans want to get paid, reimbursed by Medicare, to provide these to their beneficiaries as well. Public money now being used for this. I don't know. If they're comforting, who are we to say no? Especially they can be comforting to people in nursing homes who have dementia. So they may not be able to care for a real pet, but they remember having a dog or a cat and loving that animal. And of course, visits from their families are highly restricted in most places still. So these things cost about $100 retail, 120, maybe it's worth a try. But I would prefer that as a society, we commit to providing human companionship to people that need it, that we're promoting a kind of toy. These robot animals, most of them are manufactured by a company that's a spinoff from Hasbro. So this strikes me as an indictment. If that's the best we can do, it's an indictment of the chronic understaffing in long-term care facilities, both assisted living and nursing homes. This has been true for decades. And it's also probably an indictment of the restricted visiting policies that are keeping family away. But still, we can take it down now, Jen. Like telemedicine, robots will evolve. And so if we get to the point where the robot can do the laundry and clean the apartment or fix a meal or remind us to take our meds, then I would be in favor of that. A change I do think is here to stay. And overall, another plus is what we're doing right now, having online interactions. Would I rather be in a room with you? I would, frankly. But look what's happening around us. I know, probably you know, book groups meeting online, Scrabble players who've switched to Words with Friends and they're playing online. A friend's mother on the Upper West Side plays bridge online 5 days a week. And it takes them a very long time to get through their bridge games because they're yakking so much. So that's clearly a benefit. I'm online twice a month with a friend in Oregon who has multiple sclerosis. She's immunocompromised. So she's had to be almost completely isolated in her home and garden for months. A year ago, we probably would have sent each other, the occasional email, but now we're on Zoom a couple times a month. So even as we're hoping that maybe by summer, we'll be able to hug and shake hands and have meals together without worrying about how close am I to the person next to me, people are finding new ways to connect online, and that can be a real lifeline. One warning though, as we spend more and more of our lives online, studies from the 2016 election show that older adults are more susceptible to misinformation than younger ones. Now, this is not common among any age group, but when it happens, we're the ones more apt to do it. We're more apt to share and pass along falsehoods and propaganda and distortions. Why is that? Well, for one thing, we didn't grow up with this technology the way our children and grandchildren have. So if we can remember a time before the internet. So we're still finding our way of how to use it effectively. And also, frankly, we get targeted. We get targeted by scam artists. We get targeted by fake news sites because A, we have more money as a generation, and B, we vote. We register and we vote. So we're particularly targeted for political misinformation. So while it's not common, again, this is not something most of us are doing, but the people who shared information from phony news sites, these look like real sites sometimes, but they're put up by international bad actors, by political campaigns, by just mischief makers. And so when the people who shared that material from a fake news site were twice as likely to be over 65. We were twice as likely to do that as people 45 to 65, and we were 7 times as likely to do that as the youngest group on Facebook, which is the site that most older people use. And the same thing was true on Twitter. A 2016 study found similar disparities. So whose responsibility is it to halt that process? I would argue that the social media platforms that we are using should be responsible for rooting out fraud and misinformation. They're making lots of money from us. This is their responsibility. But while we are waiting for them to be more responsible, and they're working on it, or while we are waiting for legislation to force them to be more responsible, we have to protect ourselves and our social discourse. Jen, can we have the next one? There are digital media programs, organizations that are ready to help. There we go. This is Lindsay Dina. She lives in Connecticut. She has signed up for a program called Media Wise for Seniors. These are digital literacy organizations that are ready to help seniors navigate safely, be able to distinguish what's real from what's false, avoid getting conned, use the internet responsibly. If you're interested, Media Wise for Seniors is sponsored by the Poynter Institute. You'll find it at poynter.org. That's POYNTER.org. We can take that down now, Jen. Or also the News Literacy Project. It began as a way to help teenagers tell what's real and what's not real on the internet. And then they discovered after these 2016 studies, oh, we have to help seniors with this too. So the News Literacy Project, newslit.org, has programs for older adults. One of them is called Checkology that will also help you. AARP has videos online called Fact Tracker. It shows you how to spot misinformation, and you may also be aware of Snopes.com. Snopes.com is a site that investigates false claims online and tells you what's a myth and what's reality. Plus, we can harness our own common sense and speak up when we see friends and followers posting questionable material. I've become slightly obnoxious about this on Facebook. I'm, a self-appointed truth squad. I see people, smart people, putting up stuff and I say, that looks surprising. I've never heard that before. Where did that come from? Who is the source? Can we document that? If you don't know it to be true yourself, did it come from a reputable source? Did it come from the Washington Post? Did it come from CNN? I'm not talking obviously about our birthday party pictures or photos of the grandkids or the pretty sunset that happened tonight. I'm talking about public and political communication. We've all seen perhaps photos of doctored photos of the canals in Venice full of sharks or flamingos. Well, that's not real, but it probably doesn't matter so much. But when you're passing around things about how to vote and you don't know where that material is coming from or whether it's really intended to help people vote or to suppress the vote, that's when our red flags should go up and we should say something to people. I ask them politely if they can't document where this comes from to take it down if it's not verifiable. And sometimes people get testy about it, but sometimes they take it down and they maybe will be more careful the next time. So we can fight back against this. We're the targets, but we can also be leaders in trying to help our peers distinguish between falsehood and truth. As we get accustomed to all these new aspects of our lives, we also face some tough personal decisions. In some ways, if you think back to the early days of the pandemic, it was simpler to know what to do. It was terrifying, but it was simpler because the governor, the health department, the experts all told us what to do, especially if we were seniors. Stay home. Just stay home. Work at home, cook at home, eat at home, exercise at home, except for taking a walk around your neighborhood in a mask. Just stay home. Help flatten the curve. And then over the summer, when we did help flatten the curve, at least around here, everything got more complicated because we had more choices available to us. So we'd been cooking at home and doing takeout for months. And now, oh, look, we could eat outside a restaurant in June. And then by September, oh, look, we could eat inside a restaurant in New York City. We could go back to stores, to gyms and golf courses and tennis courts. We could go get our hair cut finally, or get our nails done. In some places, we could even go into movie theaters I don't know why you would be doing that, but you could. We had to wear masks and we had to remain distant, but the world got a little bit broader. And then we had to figure out what made sense for us individually. So many of us had small distanced social gatherings outside. Some people had larger gatherings indoors or without masks, and we all paid the price for that. It looks like we're headed for more restrictions now. In fact, in my county in New Jersey, I think in Westchester also, we already have more restrictions. And I can't say that's a bad thing, really. So that may go on for a while, and then we may have partial reopening again for a while. So for those of us that are older, especially, and at higher risk, this presents a more complicated equation. How do we decide what is reasonable for us, what is prudent for us? We know that there's no 100% guarantee of safety in a pandemic. There are degrees of risk. Could we have that next link, Jen? This shows, this is David and Nancy Nathan. They live in Bethesda, Maryland. And at the time that I spoke to them in July, they had been planning a family gathering for Dave's 80th birthday in Lake Placid. And their 3 daughters were going to join them. It was going to be about a dozen people in all. 80 is a big milestone. You do want to celebrate with your family. And they had planned this in a nice resort months ahead. They were going to drive up from Bethesda. The girls were going to drive in, a dozen people. Nancy thought, that sounds okay. That seems pretty safe. There's not a lot of COVID in Lake Placid. And Dave, who was the older one, was starting to call himself Dr. No, because he just thought it didn't make sense. So when I talk to public health experts about how we make decisions and how we face these kinds of dilemmas, they pointed out certain elements that we ought to be considering: geography, personal health factors, and our individual values. We can take that down, Jen. So first, geography. How widespread is the risk of coronavirus in the area where you are? So over the summer, when New York and New Jersey both had pretty low rates of new infections, we could have loosened up a little bit, perhaps. Whereas in Texas and Mississippi and Alabama, they should have been staying home and wearing masks, and they didn't. So now we are where we are. But now our own rates are climbing pretty quickly too. So the equation changes again. We may have to start cutting back on our personal exposure because there's more of the community spread around us. Second, what is our personal health profile? For example, I'm at risk for my age, but I don't have any of the chronic health conditions that would make me particularly vulnerable to the virus. So the CDC says, and these change over time as we learn more about who's most at risk. So currently, those underlying conditions that put you at higher risk include cancer, heart disease, kidney disease, type 2 diabetes, obesity, lung disease, chronic obstructive pulmonary disease, and smoking. So my friend here in Montclair, New Jersey, who is undergoing chemotherapy, is avoiding basically everybody except his wife. And my friend with MS in Oregon basically just doesn't leave her house. I am taking distanced walks in the park with friends, or if it's warm enough, we get takeout sandwiches and sit in the park 6 feet apart and have a little picnic. That seems safe to me. But nobody has been in my house for a visit, and I haven't been in anybody else's house except for my daughters. By the way, I'm just going to interject here and say that while we don't yet have an approved vaccine for COVID-19, we should all be up to date on our other vaccinations, right? We should all have gotten or be about to get our flu shots, the stronger version that's recommended for older people. We should be getting the pneumonia shots, pneumococcal pneumonia. These are not every year, they're every 5 years, but it's easy to forget when was the last time that you had it. So when I was last at my doctor for my annual Medicare wellness visit, I said, when did I get that pneumonia shot? And she looked and said, oh, it's been 5 years. Oh, okay. So I got it. And also the shingles vaccine. We do not want to be either taking up our time with our doctor's times, our hospital times, or making ourselves sick from things that are preventable while we're dealing with something that right now is not yet completely preventable. So the shingles vaccine is 2 shots, a few weeks apart. Shingles is a nasty disease, and this vaccine is 90% effective. We should all be doing that. End of digression. So we should be considering where we are geographically, what our personal health profile is, what puts us at risk or not. And then finally, what is most important to you? What is most important to us? Knowing that any contact involves some degree of risk, however slight, and also knowing that we can help spread a virus that we don't even know we have. What seems rational? What's prudent? What's reasonably safe? And what matters to us? So even Dr. Fauci, Tony Fauci turns 80 next month. He said that he would have a distanced dinner on a patio or a back porch in the summer with a couple of friends. That was important to him, but he said he was not getting on a plane. So those answers will be different for each of us. Here's mine, just as an example. What's important to me? My work and my daughter's family. So my work, aside from writing for the New York Times, includes teaching grad students at Columbia. And Columbia Journalism School is being very stringent about masking and protocols. We have up staircases and down staircases. We have doors that you go in through and doors that you come out of. We have random testing. I've been tested 3 times. So I agreed that I would teach a hybrid course. And through the fall, I was sometimes online on Zoom with my students. And we only had 8 instead of the normal 16. But other days, at first 2 days a week and now 1 day a week, I'm in the classroom with them. And we're all wearing masks and we're sitting far apart. This was important enough to me to take what seemed like a reasonable risk. The first day I met my students on Zoom in August, I told them my age. I'm open that I had just turned 71. I told them I wanted to be in the classroom with them. I thought that they wanted to be in the classroom with each other. And I told them it was in their hands, that they had to be serious. If they were going to parties and hanging out around bars, the whole school was going to shut down. And if we wanted to be able to meet in person, they had to be responsible. And they have been. We've only had 2 positive cases at Columbia Journalism School since Labor Day. And we only have 3 weeks left in the semester. And so far, so good. Knock wood. The other thing important to me, as Louise said, is I provide a day of childcare for my granddaughter in Brooklyn. She's 4. And she and I and my daughter and son-in-law, we are each other's pod or bubble. And we are distancing from everyone else, but we don't distance or wear masks with each other. And I'm driving there to help out, because when you have 2 parents at home trying to work from home and 1 toddler and no childcare, then it's helpful when Bubby shows up. Exercise and friendship matter to me, so I walk with friends. No more picnics now that it's 30 degrees when you wake up. But other things are not important enough to me to take the risk. I miss live theater. I miss museums. I miss restaurants, but they have to wait. It's not worth it to me. I don't travel except short distances by car. Other people will make other decisions. The Nathans, David and Nancy, whose photo you saw, they decided not to go to Lake Placid. They canceled his birthday celebration, and they're going to have to do it at another time. Public health experts are warning all of us about the upcoming holidays, Thanksgiving, Hanukkah, Christmas. I'm not going to even small indoor events, because that appears to be one of the ways that locally the virus is spreading around here. And I hope that many of you will avoid them too. They're not only dangerous to ourselves, but to other people that we could infect. An epidemiologist that I follow on Twitter said, she suggested, the following line to use with your family. I love you so much that I'm skipping Thanksgiving this year. It's a bummer, right? Let's acknowledge that. It's a tough time. It does not make us feel good. But looking ahead, I also know that elders can be tough people. By the time we've reached our 60s, our 70s, our 80s, or beyond, we have seen a lot. We have fought through hard stuff before. We have known change, profound change, and we've adapted to it. We've endured health crises and loss. Most of us have had to experience the deaths of people that we loved and cherished, and we have kept going. Older people develop emotional equilibrium. This is the work of a Stanford psychologist you may know of named Laura Carstensen, who has pointed out that contrary to all those cliches about bleak old age, older people are actually happier than middle-aged people. We learn to turn to the people and the activities that are meaningful to us and nourishing to us. We are way less concerned with what anyone else thinks of us, and we don't have time to waste. So I think we can lead. It may not be an accident that our incoming president will be 78 tomorrow. Happy birthday, Joe Biden. Um, the Speaker of the House is 80. The Majority Leader of the Senate, not my personal favorite guy, is 78. Chuck Schumer is turning 70 next week. This is a time when we particularly need and value wisdom, experience, and emotional stability. And that is what older people tend to develop. So I think we can all play a role in defining our collective future. We can model smart behavior. We can lead by example. First, by honoring the health protocols that can help turn the tide of this pandemic. If we are distancing and hand washing and wearing masks whenever we go out, and we are politely asking our neighbors and friends and passersby to please do the same, maybe we can help increase the incidence of these responsible behaviors. That could make a difference in our communities, in our neighborhoods, the way people respond to the crisis outside ourselves. We can ask for help when we need it because it takes strength to ask for help. And I'm particularly thinking about the way that rates of mental health problems have risen through this period, more for younger adults than for us, but for us too. Um, and we know that psychotherapy and counseling work just as well for older people as they do for younger people. This idea that they're too old, they can't change their ways, not true. So if we can acknowledge when we are struggling and get treatment, and we can suggest that to others too, the people around us, Medicare covers sessions with therapists and counselors. It's no more shameful to seek that kind of help, that kind of treatment when we need it, than to go to an orthopedist if we break a bone. And I would like us to be more willing to do that and more open to it. We can act as volunteers even if our formal volunteer organizations have been largely sidelined. For one thing, we can volunteer to participate in clinical trials of these vaccines. These pharmaceutical companies need tens of thousands of people for each trial, and there are at least a dozen trials going on. If older people are not included in these clinical trials, when we are the ones most at risk, then the FDA will have trouble truly assessing safety and efficacy of these vaccines. If we're at risk, we should be part of the population on whom they're tested. We should be part of the effort to defeat the virus through vaccinations. Lots of places are still recruiting volunteers. National Institutes of Health, the VA healthcare system, NYU Langone is advertising for volunteers, and you can sign up online. It's simple. I have done that. I acknowledge that nobody has called me yet and said, hey, we need you, but I'm there if they do need me. I have been giving blood. You know, the Red Cross, where does it usually hold blood drives? Schools, campuses, workplaces. No one's there anymore. They're having blood shortages. So I signed up to do that every couple months. I can tell you that they are wiping down every surface and passing out masks and obeying all the protocols. It feels to me like a very safe environment and lets me feel like, okay, I can do this much. Can't solve the whole problem, but I can contribute where I'm needed. We can also be the people who just reach out informally to our friends, to our neighbors, to our former coworkers, our current coworkers. We can reach out by phone and FaceTime or just over the back fence or in a community gathering place that's outdoors, and try to be the antidote ourselves to this isolation that is dangerous to ourselves and to others. We can be part of the solution. So last week, Dr. Fauci said that we need to hold on because the vaccines are coming. He said we need to hold on because the cavalry is coming. And when I heard that, I thought, like, nobody under 40 is going to understand what that means. You need to be old enough to remember Gunsmoke and John Wayne movies. But it was a comforting metaphor just the same. This is not the way that any of us really plan to spend 2020 or 2021. You know that line that supposedly Betty Davis said about aging is not for sissies? It's not really clear that Betty Davis ever said that. It's not even clear that she had it embroidered on a pillow, as some people said. But it's clearly true. It takes a certain amount of courage and perseverance, but that ability to endure hard times, to persevere, to be mindful of the generations behind us and how we can nurture them, to me, those are all key parts of growing older. Those are qualities that can get us through this time. And with those qualities, we can help other people get through this time too. So thanks so much for listening. I'm happy to have people offer their own perspectives, ask questions, just join in the conversation.
Okay, so there's going to be two ways to ask Paula a question. You can raise your hand and I'll unmute you, or if you feel more comfortable, you can type it in the chat and I will read it. So
I do have one private message in the chat asking, how can I suggest volunteering for vaccine testing when we are considered at risk? Well, everybody's at risk. We're just at higher risk. But that is how we find out if the vaccines work or not. Now, before they get to phase 3 testing, which is where we are now, they've already been through phase 1 and phase 2 with smaller numbers of people, but you don't get to phase 3 until you have shown that you do not have a high risk of side effects that are dangerous from this vaccine. So by phase 3, I personally feel comfortable volunteering, and I have. And so far as we've seen, especially these leading vaccine candidates, do not have high risks of anything worse than a sore arm, a headache, or some fever, which you can also get from a flu shot or a shingle shot. It doesn't mean it's dangerous, and it is far less risk than of the disease. So in phase 3 testing, I feel comfortable doing it. If you don't, if you're at higher risk than me, I certainly understand. But we do need people over 70 to be part of this population.
A comment in the chat, Paula, somebody wrote, I know 2 people who have a robotic cat in addition to a family contact. It makes them calm and happy.
Well, then great. It's a cheap fix. It's $120. And there are people for whom having an actual animal in your house would not be a good idea. It's too hard to care for them. You can't walk them as much as they need to, especially in winter. So if this works, then fine. And I also, when I was reporting the story, I talked to some people who said, yeah, my mom loves it. And others who said, no, my mom didn't pay any attention to it. And also a third group that said, well, if you remind her that it's there, she likes it. But in the meantime, it's in a closet. So different strokes. What I don't like is the idea that we have a plague of isolation and loneliness among seniors. So let's just buy a bunch of toy cats. I don't think that's a smart response. And this person did say it was an addition to family contact. It's not a substitute, I don't think. Louise
Okay.
has a hand up.
Yes.
Jan?
Yes.
It's Louise. I wanted to let everyone know that a lot of Paula's suggestions about finding places to volunteer or even taking Zoom classes, if anyone is interested and you're looking for that, you could call Deb or me or Jen, and we could direct you to sources. I know Wendy Armstrong is here from Volunteers New York. Jessica Ciaffoletti from Arts Westchester. DeRoad, I don't know if they're on, but they have a lot of opportunities. So you don't have to dig too far. If you call the three of us or the Westchester Library System, Mary Kay, you'll find some place to either take a class or to volunteer.
Thanks,
Right.
Louise. Suzanne wrote in the chat, Paula, what are your thoughts on substance abuse in the elderly population? What are your thoughts and what is your experience with that?
It's not something I know a lot about. I do know that when we think substance abuse, we tend to think opioids. Uh, but for older adults, alcohol is also a big issue. And it's the way some people are self-medicating their way through the pandemic. So, but what I don't know much about, and I invite others to chime in here if they would like to, is, I mean, this is the treatment, substance abuse treatment is covered by Medicare, but you have to get people to acknowledge the problem and seek the help. So to me, I would start with my doctor, but there may be programs in Westchester or elsewhere that are specifically aimed at treating adults with substance abuse who may need a slightly different approach than younger adults.
Thanks, Paula. Dan Jackson and Courtney Houston also shared with us DeRoteUSA.org has lots of Zoom classes each week, and DeRote has over the telephone classes via University Without Walls, classes and events over Zoom, as well as volunteer telephone friends.
Yeah, this volunteer telephone networks, a bunch of different organizations around the country are promoting, because it does allow you to have one-on-one conversations, and with FaceTime, which a number of people are used to using FaceTime to talk to their families. So you can talk to friends that way too, and try to help ease people's isolation that way. And sometimes these are set up to have like an affinity between the two people. So for example, the Motion Picture Fund in Los Angeles is putting people together that are both in the entertainment industry. So then they have something in common. It's not just, hi, you don't know me, I'm calling to check on you, but I'm a camera person and you were too. So we have something in common. And it seems to me like a good way to organize them.
So thank you, Paula. A Volunteer New York also has tech seniors available to teach tech to teens, and
Yeah.
I'm sorry, has tech teens available to teach seniors. I'm sorry, I got that mixed up. And Senior Planet is another resource that is available. Barbara, I've unmuted you. Barbara Stern works with Lexington Center for Recovery and can speak to substance issues a bit more. Barbara?
Thank you, Jennifer, and thank you, Paula. Paula, I feel like I know you because we're the same vintage and have many of the same thoughts. But I was delayed actually because I was on a call about alcohol, and I'll address this with a lot of concern. We are seeing a huge rise in alcohol use amongst seniors. They are lonely. The day is long. It's dark now. And I find many seniors resorting back to alcohol who have been able to be to not use it during the summer, but now that it's getting colder, it's back heavily in use, and mixing it with many medications is a huge concern. Plus, many seniors are driving intoxicated. So I share that with you. Lexington Center and Jennifer, as you well know, our partnership initiative for older adults substance abuse, strongly alcohol is part of our program. And any referrals can go to Tonya Monty at FSW, or you surely can contact me, Barbara Stern at Lexington Center. Thank you, Jennifer.
Thank you so much for sharing that, Barbara. Some other comments here. Another resource, Lifetime Learners Institute at Norwalk Community College. Another question, how is the best way to respond to friends who feel you are being too low profile?
I'm not sure what too low profile means. Do you mean not taking enough precautions? Is LG 280 able to clarify what you mean?
Okay, and as we're waiting for a response, another question. Paula, early in your talk, you spoke about the proposal of care homes granting a family member the authority to visit their loved one. Is there an organization involved in advocating for this whose efforts we can support?
I'm not aware of a particular organization. I think because this is CMS issues guidance for how to handle visitation, and then states have their own regulations, and the state regulations often leave a lot of the decisions to the provider. So I'm not aware of an overall organization that's advocating for this. I think the most effective way is to be organizing families of the facility where that is restricting visits, to talk about how we could do this safely. And most nursing homes and assisted living have a residence council. It's probably not meeting anymore. And they often also have family councils. So I would develop a network in the facility, or perhaps it's a chain, a small chain, where your loved one is, to talk to the administration, to bring in geriatricians and public health experts to talk to them. Part of what they're reacting to clearly was the horrific losses early in the pandemic. So the experts that I talked to said, yes, they were right in the beginning to just shut down. We didn't know much about the pandemic. We didn't know much about how the virus was transmitted. We didn't have enough PPE. Now we know more, and we should be able to set up a visiting program that trains and tests people and lets a selected number of people in. I don't know of any organization that's pushing it, but I think it's an idea that the family members and residents in particular facilities should be trying to organize with the administration and with local public health people. And in the column that I wrote about it, there's evidence from the Netherlands that you can do this. It can be done. And you could argue that being alone in your room and not being able to have contact with anyone is at least as dangerous and to the resident as the virus, because you have heard this probably, people saying, this is not a life worth living. And there are family members who are willing to sign the waivers and take the risks. Part of this always with these organizations is about liability risk. So maybe they say, if we let you in and we test you and we train you, and you catch the virus or your family member does, you can't sue us. Okay, I would sign that.
In terms of the question around the keeping a low profile, how to respond to it, our user clarified, not even distance socializing. She says she goes to the grocery store and doctor's appointments and long driving day trips on her own, but that's it.
Okay. So that sounds like a reasonable plan for you. Other people, it depends on where you are. It depends on your health, your age. I feel like taking a walk with a friend in a mask through a park when we stay 6 feet apart is okay for me. I don't think we're and from the beginning, people respond with their own feelings and sense of what's appropriate. No public health official ever said, do not for any reason ever leave your house. No one ever said that. Andrew Cuomo said, take a solitary walk. Then later, when we understood that being outside was safer than being inside, people talked about small group socializing, 2 people, 4 people, that maybe 6, that's about it for me. So we will make these decisions, and family members that can be concerned about it can propose things to us, but we are independent agents. We make our decisions. We should make them using information and not just our hunches or our fears or our defiance. They should be based in reality and in what we know. But if, LG, if that's what feels right for you, and you don't want to take a walk with a friend or have a picnic with one other person in the park, then God bless. You are not infecting anybody else. But other people do not want to go to the grocery store because they feel like that is where they're most exposed. So they're doing online delivery. I don't feel that, so I go to the Acme. But I think what serves us is to be thoughtful about this and not to be defiant. Do we really need to have 500,000 motorcycle riders in Sturgis, North Dakota last summer? They seeded the infection through the entire Midwest. To me, that is the thing that is not worth it.
Some more comments. Vision Services for the Blind and Visually Impaired is providing seniors in Westchester free services and supports to assist seniors to maintain independence at home and in the community. Also, ltccc.org is a resource as well. I see some more stuff here.
Oh, that's a good idea. The ombudsman for every county is supposed to have a long-term care ombudsman, and that is contacting that person is a good way to start the conversation about changing visiting policies at long-term care facilities.
Amy says that she agrees that resident and family councils are good avenues to assist in advocacy for nursing home visits. She says you can also try the Ombudsman group for your nursing home, as well as the Long-Term Care Community Coalition in New York City. Mary Kay also shared Facebook has a group called Caregivers for Compromise, which advocates for permitting family visits in long-term care facilities. And LG280, Paula says, I'm used to being independent. Thank you for your response.
Well, aren't we all? It's one of the things that comes with age, right? Is a sense of we know what's good for us, and we're less worried about what anybody else thinks about us.
Louise, you're unmuted.
Okay, thanks. I've gotten a request from somebody. I just want to clarify. Will the recording, the link to this recording, will people be able to get it? And how do they, if so, how do they get it?
Yes, and that's a perfect way to end as we're just approaching 11:30. Thank you, Louise. Yes, the link for this recording will be put up on our Care Prep website. So that's www.careprepwestchester.org. It's all one word. Again, www.careprepwestchester.org. I want to take this time to very, very sincerely thank Paula for being with us today, to thank our age-friendly collaborative, and to thank all of you for being here. This has been just such a pleasure. Paula, thank you.
So next year we'll all be together in White Plains, right? Right.
Oh, here's hoping. Here's hoping. Thank you, everyone. Oh, Deb?
I just wanted to mention, did Paula not have a book that we were looking to let everyone know about? Did we already say that?
Oh, Paula, please.
It's not available until the spring. It's an audiobook from Audible called The Bubby Diaries. It's based on my New York Times columns about grandparenting, but it's not published until probably the spring. But thank you.
You're welcome.
Thank you, Deb. Okay. Paula, thank you again. Thank you, everybody, for joining. The recording will be put up shortly.
Take care, all.
Bye-bye.